Hello, my dear friends. This is Dr. Charles from PHI Preventive Health Institute, where we share practical lessons drawn from real cases we see every day. Behind many cases of simple facial swelling, there is sometimes a much deeper infectious process quietly affecting the body underneath. And today's topic focuses on something many people recognize by name but often underestimate completely: mumps. The swollen cheeks, the painful jaw, the fever, the difficulty chewing, the fatigue that suddenly appears. At first, many people dismiss it. Maybe it's tooth pain. Maybe it's just a swollen gland. Maybe it will go away on its own. I don't feel that sick, but sometimes the body is signaling a contagious viral illness. Because mumps is not simply about swollen cheeks. It is a systemic viral infection affecting multiple systems underneath: the salivary glands, the immune system, the nervous system, the reproductive organs, hearing function. Everything becomes connected. When the pattern begins quietly, in clinical practice, mumps rarely begins dramatically. Often, the early symptoms appear mild: low-grade fever, body weakness, fatigue, reduced appetite, headache, pain while chewing. At first, many people continue normal life. They go to school, go to work, attend gatherings, stay around family members because the symptoms still seem manageable. But underneath, the viral process is already developing silently. Then gradually, the pattern changes. Swelling begins near the jawline. The cheeks become tender. Swallowing becomes painful. And because many viral illnesses initially resemble one another, some patients delay evaluation while the virus continues multiplying. What is really happening inside the body? Mumps is caused by a contagious virus spread mainly through saliva and respiratory droplets. It spreads through coughing, sneezing, and close contact. People may infect others before they even realize they are sick. The immune system activates, inflammation increases, the salivary glands swell, and hydration becomes more difficult. And in some patients, the virus extends beyond the glands. This is where complications may begin progressively and quietly. From the medical perspective, mumps is often preventable through vaccination. But when infection occurs, monitoring matters greatly. Visible swelling is only one part. Complications may involve the brain, the testes, the ovaries, the pancreas, and hearing function. Warning signs should never be ignored: severe headache, neck stiffness, persistent vomiting, or difficulty breathing. Now bringing the nursing perspective. Much of mumps management depends on supportive care and preventing spread to others. Rest, hydration, fever monitoring, soft foods, good hygiene. These simple routines matter more than many realize. Continued exposure can spread infection through schools and workplaces. Staying home during active infection protects the community. Now bring in the pharmacist perspective. One of the biggest misconceptions is unnecessary antibiotic use. Mumps is caused by a virus, not bacteria, which means antibiotics do not cure the infection itself. Supportive treatment focuses on fever control, pain management, and monitoring for complications. Avoid self-medication. One of the strongest protections is vaccination. The MMR vaccine helps protect against measles, mumps, and rubella. Widespread immunization has reduced severe outbreaks worldwide. Successful prevention is often invisible but essential. Early recognition matters. Supportive care, hydration, isolation, and vaccination protect the system and the community. Do not ignore persistent swelling. Protect the system early. For consultations, contact PHI Preventive Health Institute. Stay safe.